All again for so you can see that this meeting is going to be recorded, and that's just in case you want a recorded version of it. We'll have it available to you. But again, my name is Carlos Green, and thank you again for joining our webinar today, Return to Work Amidst COVID-19. I serve as the Senior Program Director at NACo and co-sponsoring this webinar today on behalf of our Workforce Network. Now, we all know it's been pretty daunting what COVID has done to our lifestyles, and many of you now are wrestling with the appropriate protocols of having employees return to work safely. There have been multiple days probably where you've been planning on having employees return, and then another surge may have occurred, and then you have to change that date to return. And if they do return, there are so many protocols that you put in place for all of your employees. So today I'm anticipating a very robust presentation and conversation today regarding these items. And before we begin our webinar today, there are a couple of house items that involved. First of all, if you have any questions during the webinar, please feel free to put them in the chat, and our chat master, Alana Hurley, will ensure that those can get to us so that our panelists will be able to respond to those. I will be operating the PowerPoint presentations for the webinar today, so have grace on me as I facilitate through the PowerPoint presentations. Also, during the registration of the webinar, there was an article penned by our Coconino, Arizona County panelists, where there's some great information regarding this topic, and we hope that you all have had a chance to read that. And then lastly, after the webinar has concluded, you will receive copies of the presentations that you can reference at your convenience. I am honored to be joined by our Chief Administrative Officer here at NACo. Her name is Dr. Debbie Stoudemire, who will give us an overview of the Workforce Network, and then we'll introduce our esteemed panelists. Debbie.
Great, thanks, Carlos. Good afternoon, everyone. And again, welcome to the NACo Workforce Network Group. As Carlos said, I am Debbie Stoudemire, the Chief Administrative Officer for here at NACo. We are so excited that so many of you have expressed interest in this network. This is actually our second webinar, and we have more than tripled the number of attendees since the first one. So really excited about that. Just to give some context, we wanted to start this network because we know your jobs are challenging. And we believe that the only people who truly understand what you do are those who actually do the same thing. And the best way to get answers to some of the questions that you may have is to ask people with experience. And having a group of knowledgeable professionals at your fingertips is what we're really trying to do. And that allows you to hear different perspectives about the challenges you face every day and to find tested solutions that could work for you. It's safe to say, I'm sure all of you will agree, it's safe to say that this past year has been interesting or challenging, having to deal with COVID-19, keeping your workforce engaged remotely, its impact on culture and civil unrest and more. Our hope in establishing this network is to meet the needs of county administrators and other HR professionals in this space. We're looking to provide an exchange of resources, a platform to share best practices of all aspects of human resources, including HR policies, job descriptions, employment law updates, and opportunities for continuous learning, among other things. We'll focus on topics such as DEI, talent retention, employee well-being, professional development, performance management, compensation, and general trends. That's just to name a few. Finally, we value your insights and contributions as leaders. So we want these webinars to be not only interactive, but we want to have relevant topics. In addition, we want your input, and we invite you to participate with other professionals to get your thoughts on how we can prepare for things like the new norm. How do we integrate telework? How do we take care of our employees' mental health and well-being? The last webinar, we asked participants to share their top concerns or on issues they would like to discuss. And reentry was the #1 issue listed. I, like many of you, had a lot of questions over the past year. When should we ask employees to return? How should they return? Should they return staggered, by department, all at once, etc.? But most important, what are those legal landmines that would increase our risk exposure? So we've invited some experts to help us with these questions. and I'll introduce them. First, we have Russell Broke with the firm of Morgan Lewis. Russell advises clients on diverse sectors on compliance with the Fair Labor and Standards Act, the Service Contract Act, state wage and hour issues, per diem issues, and wage payment requirements. He also counsels on employment policies and procedures, hiring and termination issues, and executive employment contracts. Now, Russell is joined by Alana Genderson, also with Morgan Lewis, and she advises clients on labor and employment best practices and defends clients in all phases of federal, state, and administrative employment litigation. Among other matters, Alana defends employers in the whistleblowing proceedings and against claims of discrimination, harassment, retaliation, and wrongful discharge. And I'm going to apologize up front if I mispronounce anyone's name. I think it's Alana, not Alana, because we have an Alana that works with us. And it's, I have one place says Morgan Lewis and other ones say Morin. So I'm assuming it's Morgan Lewis. So I apologize if I said something wrong. In addition to those, we also have Erica Philpott, who serves as the Coconino County, Arizona Human Resources Director. Erica's background includes diverse work in the human resource field in the public, private, and non-private sectors. She is published in Human Resource Matters, and Erica teams returned to work in July. So she will share her experience with us during this transition and what we should be looking for when we do decide to return to work. We're actually returning to work Monday, which is October the 4th. So I'm very interested in hearing your experience. As I said earlier, we'd like this webinar to be interactive as possible. You may ask questions in the chat as we go along. As Carlos said, we are recording this webinar, and afterwards you'll be sent a link to review at your convenience. We have a full agenda. We have interesting topics and great presenters. So let's get started. Russell and Alana, you're on.
Debbie and Carlos, thanks so much for inviting us for this presentation today. And I completely agree with you that it could not be more timely, and employers are really facing unprecedented challenges. As you were going through our bios, I was just thinking Alana and I really need to update our bios, because lately we've been doing COVID counseling almost full time. It's really overwhelmed, I think, everybody across industries on what to do about COVID, not only return to work, but vaccinations. So in today's presentations, those are going to be the main two topics that Alana and I are going to discuss: coming up with a return to work plan, some best practices, and also what to do about the questions about whether to require vaccination or not in order to return to work. As Debbie and Carlos said, we're really here for you today. So we want to make this as interactive as possible. We're going to be trying to monitor the chat as we go along, and we'll try to answer your questions as best as we can. I also want to put the caveat out there Alana and I are national counsel, and we know you're across the nation. So we're going to focus really on high level, mainly some federal guidance. We can't get into each county specific or state guidance, but we'll try to do our best to answer questions that you have. But we always have the caveat on, you want to make sure you're compliant with your local rules. Just because I'm in Washington, D.C., something might be okay here. If you're in Arizona, for example, there's very localized rules. And we do recommend you checking with the State Department of Labor. If you have also, local EEOC or other guidance, those state laws and guidance are really a great source, because the laws can vary state to state, jurisdiction to jurisdiction. So if we go through the slides here, Carlos, you want to just advance it to the next segment here to kind of go over the agenda. As I mentioned today, we're going to really discuss planning for return to work and vaccinations. And for part one, I think really the planning for a return to work, the key that I'm seeing is, number one, have a plan. I think that's really key on having clear guidance and a plan and just communicating it to your employees. What's going to be expected? Are you going to have masks? Are you going to have to be vaccinated to return to work? Are you going to allow remote work? And if so, how often does that occur? And is everybody going to be treated the same, that everybody has the opportunity? Or is it only going to be certain positions? Where I've seen employers get in trouble in this area, not only from a legal perspective, but just from an employee relations perspective, if they're not upfront in communicating to employees what's going on. And I've often seen sometimes even just communicating we're working on it is better than keeping employees in the dark a lot of times, because they're going to start to wonder what's going on. And I think even if you don't have, concrete guidance yet, say we're working on it, can really help ease a lot of employees who have concern in this area. So if we want to move to the next slide, Carlos. Again, these are some things, a lot of employers have committees about a return to work plan, establish a task force, do a risk assessment on, are you going to require masks? Are you going to require the employees to be vaccinated? Communicate the plan, monitor the plan, and document the process. One thing that's really come up lately is a lot of, counties and states are having mask mandates. They're going to, even if you're vaccinated, you have to have a mask. So you might want to think about having a policy in place. Who's going to monitor that if an employee is not, wearing their mask? You don't want to have everybody be the mask police necessarily. So come up with a plan rather than taking, independent action. Who should they report that to? What is the procedure if they're not following your internal guidance or the state's guidance on that? So again, just having the plan and documenting the process there. Also, are you going to have
another?
Oh, go ahead, Alana.
Sorry to jump in, and great to see everyone. The other point there is a few months ago, there were a lot of distinctions based on vaccine status. So, whether you had to wear a mask or could take it off, there was often that distinction. And we're getting a lot of questions about how to identify individuals who are vaccinated compared to unvaccinated. Most of those have gone away, at least under state and local law, but that's another area that you just want to make sure that you know exactly what applies exactly where you are, because there are different stances all over the country. CDC guidance conflicts with guidance in Philadelphia, for example, which we have an office there. So just make sure you're really digging into those issues as you formulate your plans, and have room to update them, because of course the pandemic is changing constantly. You want to make sure your plan is as well.
Sure. And I think, Alana, that's a great point. Are you going to make a distinction between those who are, if you can, vaccinated and not? And one issue that's really come up is, how do you collect that information? When do you require it? Who's going to submit the proof? Where's it going to be documented? Is HR going to be responsible for collecting that? Who's going to be the police if somebody who's not vaccinated does want to come into the office? What's going to be the plan and policy? Do you have any best practices on that, Alana?
Yeah, so we've been helping to roll out these kinds of vaccine mandates for months and months and months now. And to the extent people weren't already thinking about vaccine mandates, the White House's recent announcement about OSHA's anticipated ETS and federal contractor executive order as well has definitely put the spotlight on this issue. As far as best practices for documentation, you can do everything under the sun, right? There are a lot of options. A lot of employers are going with things like attestations. So you'll have employees fill out a form that says, I, hereby confirm, and you can add subject to penalty of perjury, or, knowing that if I lie, that's a terminable offense in and of itself, that I'm fully vaccinated. The other option is to just ask people to email in a copy of their vaccine card. The benefits of having the vaccine card on hand, and there are pluses and minuses to both, right? A lot of people are uncomfortable with the idea of providing personal medical information, which vaccine cards show birthday, date that you were vaccinated, and which vaccine you got. That's really the key information there. So the attestation is just one way to make people feel more comfortable. The downside is, as we look forward to booster shots, and potentially having booster shots be rolled into any definition of fully vaccinated, if you don't have the dates on which people are vaccinated and the type of vaccine, since right now only Pfizer has been approved by the FDA and the CDC for boosters, if you don't already have that information, you might need to collect it down the road. I don't know how many folks on this call will actually be subject to OSHA's emergency temporary standard as government entities. But employers, private employers in particular, during this period where they just don't know, we don't know what will comply with the OSHA ETS. A lot are opting to collect cards because ultimately we have seen some state and local laws that do require the actual copy of the card. So those are all things to consider. And then just before, I should also mention, all of this is considered medical information by the CDC, by the EEOC, which is the agency that enforces our discrimination and other laws. And so you want to make sure that you're keeping, whether you do the attestation or a copy of the vaccine card, that you're keeping a separate and apart from an employee personnel file and access limited on a need to know basis. So really making sure only those who need access to the information have it, and it's kept confidential.
I think that's great advice. And another thing I've seen, just so we're on the topic, I know we're jumping around a little bit here, but with getting people vaccinated, it's really a carrot in the stick approach. We're seeing more and more employers really struggling with this. I think if we had this presentation 3 months ago, it was more carrots. I've seen a lot of employers that are offering, PTO, additional PTO, time off, maybe even a bonus if somebody's getting vaccinated, really just trying to encourage employees to get vaccinated. I think in the past few weeks, I've seen almost a sea change in that it's really the carrots are dropping and more sticks are coming out. They're really thinking about, how am I going to mandate people to get vaccinated? Am I going to change their benefits? Am I going to, draw a hard line and not allow them to return or potentially terminate their employment? So I really, you want to think through those various issues of, are you going to have a vaccine mandate? And if Carlos, if you actually want to go, since I know we're jumping around a bit, but in part 2, we could just go there since we're already on vaccines, and we can come back to the return to work plan. But we've seen various types of vaccine mandates. We've seen soft mandates, we've seen hard mandates, and we've seen no mandates at all. And those are all 3 viable options that you have in terms of whether you're going to require people to be vaccinated to return to the office. And Alana, do you have a sense on, some of the trends you're seeing with that?
Yeah, absolutely. And another category we could throw in that I've seen is, within each of those, you can have different policies for your corporate staff, or for people who are in offices essentially, compared to people who are more so-called frontline workers. And the division of how policies are rolled out are not necessarily what you would first think, which is another way to say, I've seen office workers who have a higher percentage of people who are voluntarily being vaccinated anyway, outside of any employment policy, having vaccine mandates for that population, but not doing it for those who are, working in different environments who might be more hesitant to be vaccinated. So depending on your business needs, the goal here, or at least one of the goals to keep in mind, is business continuity. And so if you think that there will be a big shortage or a lot of people will leave their jobs if subject to the vaccine mandate, that is also a factor that we've been talking about a lot with employers. So and one way to mitigate that, the loss of talent with a vaccine mandate, if that is your work environment, and this is just knowing your working population, of course, but the option of a soft mandate is one way to avoid that kind of loss of talent if that's a big pressing issue for you, like it is in, let's say, for our clients in the food industry where we're having trouble staffing restaurants, et cetera. There it would be more difficult to roll out a mandate, and so people are opting for the soft mandate in those environments. Yeah. Overall, we had been tracking every company that has publicly announced a vaccine mandate, and Russell's description is spot on. It was a rare thing, and we were working with clients who were doing it, really at the outset, when it was less common, but the floodgates have opened on that topic. So that there are many employers out there that are doing the hard mandate, because, and we can get into this topic too, with a soft mandate, you're doing, most employers, and to comply with OSHA's ETS that we know will be rolled out soon, you'd have to do at least weekly testing, and there are a lot of costs and administrative burdens. And actually, Russell, you're the perfect person to talk about that from a PTO and wage and hour perspective. You want to talk about soft mandates?
Yeah, so the soft mandates, it's the question of, and that is really, you can either get vaccinated or I'll allow you to test. A lot of employers are saying, I'm going to allow you to test weekly, and you just have to verify it. I think initially a lot of companies thought it was, oh, this would be a nice way to be a soft mandate. But I think there's a lot of issues to associate with testing and some unintended consequences. First of all, how easy is it to get the test? A lot of individuals are struggling to get the test or not available. Am I going to just require a test at home? Am I going to require a PCR test? So what type of test are you going to mandate? And then to Alana's point is, who's going to pay for that? That might be, there is some guidance that testing is compensable activity that counts as work. So you might have to pay for that. Also, who's going to pay for the kit? A lot of states have reimbursement laws. If it's required for the job, it's a business expense. I'm going to pick on California because they have probably the most strenuous laws. California has clear guidance that says you have to pay for this test, employer. So that's going to put a lot of burden on, your county organizations here. Who's going to pay for this time? How do I get it? But even from an administrative perspective, it puts a burden, I think, on a lot of HR professionals in that, am I going to have to monitor this? Like, Alana, did you get the test this week? How am I going to submit it? Is it medical information? Do I have to have a secure file for keeping this? So that comes back to my main point all along, is having a plan, trying to think through some of these things and not just spontaneously rolling it out. Because I think a lot of folks is like, oh, we're going to allow testing, but they haven't really thought about the associated costs with the testing and the associated administrative burden. And I think, Carlos, if you want to go through a couple more of the slides. The other thing that we're really seeing, and throughout my practice, I've never seen it as much as now, requests for accommodations. Even if you have a hard mandate, we are seeing more and more religious and disability requests for accommodations. And Alana, do you want to give a kind of high-level overview of how those are handled?
Sure. So employers are required under the ADA to accommodate medical disabilities or conditions with a reasonable accommodation, unless that would constitute an undue hardship on the business. So those are the key issues, or would be a direct threat to others. I guess those are the three issues that I think of. So one, is it a qualifying medical condition? Two, would the accommodation requested, or any accommodation, be an undue hardship on the business? And for medical, there are different standards than for religious accommodations. For medical, it would really have to be a substantial burden on the business before you could say no. So essentially, that is much more employee friendly for medical conditions. And then finally, direct.
Hey, Carlos, do you want to just advance the slide? We have a slide on this. Just to give some context while Alana's talking. Sorry to talk over you, Alana.
No, this is great. Hopefully I'm saying what the slide says, so you all can double check me. And then the final one is direct threat. So if you granted the accommodation, would the person still be a direct threat to others while they're in the workplace? The problem, and then let me just quickly go through a religious accommodation request as well, because it's a similar construct under Title VII, where does the individual have a sincerely held religious belief? Would their accommodation, is their accommodation request reasonable, or would it be an undue hardship? And similarly, will the individual still be a direct threat to others? The difference here is that for religious accommodations, except in New York and California and Puerto Rico, as far as I've identified, for religious accommodations, the standard is de minimis. So if something is a de minimis burden on the business, anything more than a de minimis burden on the business, you can say no to the requested accommodation. In short, it's easier to say no to religious accommodation requests than it is to medical accommodation requests. And as far as accommodations to think of, the biggest one that we've seen is requesting to work from home. Otherwise, it's requesting testing plus masks plus distancing. And so those tend to be the two that are really up for consideration when it comes to a vaccine mandate. And this slide says, when it comes to medical conditions, there are actually very few that would prohibit somebody from receiving a COVID-19 vaccine, according to the CDC. And so that's one that we've seen a lot fewer of, frankly, than religious accommodation requests, because when you go on the CDC website and you look at what would prohibit somebody as far as a medical condition from receiving a vaccine, the list is actually few and far between. It's a lot of allergies to an ingredient in the vaccine is what would really prohibit somebody from being vaccinated. So for medical accommodations, to the extent that an employer wants to push back on an accommodation request, that's one place to do it. Religious accommodation requests are trickier for all of the reasons that I'm sure all of you can imagine. I mean, among others, HR typically does not want to be in the position of pushing back or having a conversation about an employee's religious beliefs. You know, it's uncomfortable, and it's not necessarily what HR is set up to do. So on that front, I've had a lot more questions on religious accommodation requests and how to navigate these somewhat uncomfortable, issues with employees. And they are, for religious accommodation requests, it has to be sincerely held. So you can, and this goes for medical conditions as well. One nice way to bridge the gap is to ask for confirming documents, really the specifics of how the person's construct of religious construct prohibits, it ties specifically to the vaccine and not being able to receive the vaccine. So a lot of times when you dig into this question, you'll learn that the reason is actually unrelated to religion and related to, let's say, politics or safety concerns, for example. And then you can have that conversation with the employee. So at minimum, I would leave you with, as a best practice, is just be prepared for these, because they're going to come in relatively large numbers compared to other policies that you've rolled out. Be prepared and have a process to have that. What is required is an interactive process with another individual. So make sure you're ready to have these conversations and that you have some of these decision points set up as far as what you would tolerate and what would be an unacceptable result for your business.
And I think all this comes back to, I know, since your government, there's going to be a lot of employees that are potentially covered by collective bargaining agreements. That's just throwing in another wrinkle for this, because the CBA may have a guidelines, the union may have a position on whether this is compensable time or not. So I think in your scope of employment, that's just another wrinkle to be mindful of that some private employers might not have to worry about. But to the extent that any of your county employees are a part of a union, make sure that you're thinking about the CBA requirements and can you require this. We've seen that a lot with the federal government. Luana and I are both in DC. Some of those unions, federal unions, are really pushing back on doing mandates. So that again comes back to having a plan in place. Are you going to pay for it? And if there is a CBA, making sure it complies with the CBA and the union's not going to file a grievance over it. I think that's a really good point. But I know we're kind of running out of time, but just to kind of wrap it back up, Alana, I think raised a really good point with the request to work from home as an accommodation. And I think we're seeing also a change in the law in this. Before, working in the office really could be an essential function of the job. That's getting harder and harder now, as everybody was working remotely before. So the employees have a really good argument. Hey, if I could do it before, why can't I do it now? And kind of coming up with business justifications. There are business justifications why requiring employees to come back into the office, but I think it's a lot harder. And if you are going to allow employees to continue to work from home, we really highly recommend having a plan in place on what that agreement covers. Like, are you going to reimburse them for any cost? Is it a voluntary cost or is it required? If they are vaccinated and allowed to return to the office, how often do they have to come back into the office? Are they going to be allowed to move out of state or out of county? We've had this a lot. A lot of people like to go to Hawaii. They want to go to California. They want to go where it's warm and some sunny destination. Are you going to allow that? Because that has implications not only from a tax perspective, or state tax is going to be involved, or you have your payroll set up, but just different employment laws. if you have somebody, we're in DC again, if they move to California, they're going to have different meal and rest break requirements. They will be covered by California law. So before you grant that request to allow somebody to work home, especially if that's going to be a policy going forward, you really want to start thinking through some of those issues. And we really do recommend having a written agreement with employees about what's going to be the expectation. So it's upfront. Because again, when everybody's starting out, everybody's happy, this all seems good, but then 2 years from now, when something goes wrong, they're mad about something, you don't want to have a dispute and then say, well, I thought I was allowed. At least if you have a written documented, remote work agreement, that can solve potentially some of the issues. Alana, do you have anything else, or Carlos, do you have any questions for us?
The only thing I would add is we left you with a lot of slides. It's so many topics to cover. Really, this pandemic has impacted every aspect of employment law, which is why Russell and I have just been talking about COVID-19 since March 2020, because there are so many questions to work through. So, take a look and make sure that you're thinking about these big picture issues.
That's great. I do have a lot of questions that are there. I'll reserve those until the end when we have the question and answer segment. But there's about at least 3 to 4 questions that are actually out there now that we'll be looking to respond to.
And the other thing on this is, Alana says, the law is constantly changing here, or it's unsettled. There's not a lot of precedent. This is a new pandemic. We're struggling to find in a lot of times what the correct standard is. And, the government's coming out, the different agencies are always coming out with guidance. I do recommend looking at those agency websites and the FAQs. They have a lot of good guidance and some material that's out there to the extent there is an answer. Even Alana and I, who are experienced practitioners in this area, are really coming up with some novel questions and ideas where they're really, the law wasn't designed to deal with this situation. We're coming up with best guesses a lot of times. So everything is changing. So, these slides 2 months from now might change, but I think having a plan in place and looking for this and knowing what to do, these are going to be best practices that'll serve you well.
Great. Thank you.
I'm having some problems with my screen here. If you don't mind, if you can just hold on a second.
Sure. And while you're doing that, I'm going to bring up the next presentation with Coconino County.
Great.
Mm-hmm.
I can't believe I did that. Hold on one second. Got it up. Okay, give me 1 second. Well, I just lost a whole bunch of stuff here. So I'm having a hard time here. I can't see the screen. I can't see anything. So Carlos, I am definitely going to need your help on this.
Okay, no problem then. We have it at this point. So thank you all for being patient with us. I'm actually bringing up the Coconino County presentation at this point. And Eric,
hey, Carlos,
I'm going to turn it over to you. Can you hear me?
Yeah, I was going to say, let's see, 1 second, do I have that? Could you do me a favor? I totally missed Rose on there. Can you please introduce Rose? I just lost everything. I don't know where anything is right now, so I apologize for that. So I really need your help on this.
No problem then. We've got on the line with us Rose Winkler, who is the Deputy County Attorney for Coconino County, Arizona. And we have Erica Philpott, who is the Human Resources Director for Coconino County, Arizona. Those are the two ladies who actually authored and penned an article in County News that was really educational and informational regarding this COVID-19 and return to work. So when I reached out to them to ask them, they were so gracious to say, yes, we can be on. And I really want to turn it over to Erica, either you or Rose, and kind of walk us through over the next 12 to 15 minutes your perspectives and what you've encountered over this COVID-19 season. I guess I could call it a season, right?
Thank you so much, Carlos. Yeah,
sure.
It has been a season for everyone, and Rose and I are going to tag team the next few slides, and we're so excited to be with everyone today. Thanks for having us. So Carlos, if you could advance to the next slide. During COVID, Coconino County also, like many of you, experienced not just testing and immunizations, but also wildfires and floods, and we ended up helping sandbag in communities. So it was a really good reminder that the rest of our book of business did not stop, that community still needed us in a variety of ways, and that we had a large group of employees who were working from home, but we also had a large group of employees who were in the building and on site in the community. And so we wanted to honor those people in all of our communications regarding reentry, which we did in July 1. And so how did we honor people who kept the courts open, who kept juvenile probation open, who continued to work in person? Because they were also really nervous about the reentry. They had become very accustomed to having a greater space and more personal space, and they were worried about people coming back as much as people were worried about coming back. So we were referring to them kindly as our warriors that kept those buildings open. We were thankful for their dedication during the pandemic. And so it really helped our values shine. We were reminded why we were drawn to public service and how much we enjoyed working with community and being part of community as well. And so Rose and I are going to talk about some things that we did, and I'm going to toss it over to Rose so she can go over the next slide.
Thank you, Erica, and thank you, Carlos. Yeah, so some things that we did even before reentry, really, obviously as all of, everyone else on the panel, everyone else viewing had to do was really adjust to the pandemic. And so obviously that started with closed buildings. And so we had to get creative because, while we had many people able to switch to remote work, there are certainly services that had to continue and had to take place in person. So, in addition to those closed buildings, one of the things that we were able to do that we thought was creative and ended up being extremely valuable, and that we've continued today, even after reentry, is we found a space to have a drive-through window. So one primary function of that was that, for a county treasurer, there had to be certain transactions done in cash, and those had to continue throughout, even having our buildings closed. And so this allowed, county staff to remain safe. It didn't require, the entirety of the staff being in the office. And it allowed residents to stay safe as well, as they were able to drive up, conduct, whatever the transaction was. And there wasn't actual in-person interaction, but this transaction could take place. And we also were able to use this window during the 2020 election. Again, obviously all of us had to conduct elections during a very difficult time of the pandemic. And while we found, many other sort of creative ways like outdoor spaces and such to try to do that, we were able to use this drive-through window as well for early voting. So, anyone who had gotten ballots in the mail or anyone who wanted to receive an early ballot could come here and again, conduct that transaction without actually putting anyone at risk. So another thing we did, again, initially as buildings were closed, in-person services were extremely limited, only on a, really necessary basis and only by appointment. As things became necessary, and then as we kind of started to move through our reentry plan, we switched to some metered entry. So buildings were still locked, but this was a system so that staff on the inside could allow people in. It wasn't appointment only, but staff could allow people in and manage how full any lobbies were. So again, that kept staff safe. It kept our residents safe so that you could come in as needed, but you might have to wait outside for a little bit until someone else exited. So that obviously was going to be based on how big of a lobby. Some lobbies are quite small and some are much bigger. And so that really allowed each building to customize as appropriate. And then another thing that we were able to do is just consolidate some spaces. So not in a manner to push people together, but in a manner to allow, to keep residents from having to hop from one building to another. We were able to get out of some of our leased spaces and move some of those offices into spaces that the county already had. And ultimately that also, as I'll mention on the next slide, also gave us an opportunity to redesign spaces. And so I'll go ahead and jump to that, but you can see in that picture, and I think that's HR, Erica can confirm that, it gave us an opportunity to look at the space and say, well, can we move people around? Can we move workspaces around to give each other more personal space for when reentry occurred? So as Erica mentioned, we did start our reentry July 1. And as Russell indicated earlier, we did it with a plan in place, and that there really wouldn't have been a way to do it without that. And our plan involved 4 phases of reentry. And that plan was actually put in place pretty early in June of 2020. At least that's when it was all set out. But it didn't include strict deadlines. It didn't include strict timeframes. It really was going to be guided by what CDC guidelines provided and what the situation was in Coconino County. And so we really just wanted to have a plan, but to provide some flexibility. And one of the things that aided us in developing this plan was we created an employee reentry team. And that was really important because, most of the people continuing to work in office were employees who were performing essential functions that had to be in the office. And so it was important to make sure we were getting input from those employees as well as employees who are doing remote work as well. Obviously, each group of employees would have different concerns. And so it was important for us to, bring all that together so that that team could communicate with leadership and really have good input on this reentry plan. We also had a leadership reentry team as well that worked with that employee team. And that also guided us in determining how to communicate with the county workforce and how to communicate with the public. And that was really important, especially as we moved through each phase or in these situations where CDC guidelines have changed. And so one of the things that we did with that was certainly we did surveys. We wanted to get as much of a feel for the entire workforce's thoughts on the issues associated with reentry. But another thing that was valuable was we conducted town halls, all remotely. And we would do a couple different opportunities so that employees on different work schedules would have the ability to, if they missed one, to go to another. And that really was great because one, it allowed employees to ask questions, both of leadership about reentry, also because we have county public health officials and other experts within the community. We were able to bring them in and people could ask COVID specific or vaccine specific questions to them. And then it gave the county the opportunity to try to dispel myths and address, misinformation that was going around. So those, I think, were really excellent opportunities for communication to take place and hopefully, provide some education opportunities. Another thing that we did as we approached reentry as well, we had to dust off our remote work policy that certainly did not, plan for a pandemic and get that updated, get it changed in a manner that really recognized that we were going to have a large portion of our workforce continuing to work remotely. And, what did we need to address? And, consider that sometimes that was going to happen because of school closures or because of quarantine, obligations on the part of either those individuals or their family members. And so we used that opportunity to make updates there. And then, I already addressed to some degree some of the shared space or open space, but another thing we've done, even as we, committed to July 1 as a starting point for a reentry, we've still done it with flexibility. And so, we're not 100% in the office. We're still using metered lobbies. But what we've also been able to do is kind of provide departments the flexibility to figure out how that's going to best work for them. So I think HR, does this. I know IT does it where we have a rotation schedule. So, you want someone in the office at all times, but not everybody has to be there. So you work, 3 weeks remotely, and then you have 1 week in the office, and that's a rotation, and everyone takes part in that. And then other departments who have just said, given our space, this is how many people we want in the office, and everyone else will continue to work remotely. And maybe we'll change things up as people request it, but it's not something where it's on a more strict schedule. And so again, we've in some spaces revised the workspace itself so that employees who are working remotely or who are kind of trading off can share space. Not everybody needs their own individual workspace anymore. And so we've revised things, one that allows us to create space, between individual workspaces. And then those spaces themselves are shared as employees are either in the office or working remotely. So I think we can move on to the next slide, and Erica will pick it up again.
Sure. Thanks, Rose.
I'm moving to the next slide, but I'm writing all of these notes and questions down that I have you guys. So
we can stay on that slide for a minute, Carlos. I can talk a little bit about the HR experience. So we do work 3 weeks out, 1 week in the office. When we came back, so we lessened our footprint. We got out of our lease and we moved. So we moved several departments in the middle of COVID. IT, HR, adult probation, community development, and finance all shrunk their space, lessened our footprint. So some of those leases were up for renewal, some we were able to cancel or get out of. And so you can see that there are 4 people in that picture of HR, but we do have a mask mandate. So people knew what they were, when they were expected to wear a mask in the building. They also wanted to know how many people were going to be in the space and what would it look like. There was a lot of fear about being able to envision that. And so some of the departments had sign-ins. This is how many people will be in the office this day. If you're going to pop in and pop out to grab a file, this is when you might want to do that because this is how busy it would be. We also had a lot of questions from departments about what to do when someone calls in sick. So if you are required to be in the office, it's your 1 week in the office and you're sick, do you still work or do you take that time off? And that was a really important question because people would say, I have a couple symptoms, so I don't want to expose everyone else. And we really learned how to stay home sick, which was a silver lining of the pandemic. But can I work today? I feel well enough to work, but not well enough to come in. And so that was handled differently by some of our different departments. Some departments said, we want to honor that you're sick and that you have sick leave, and we don't expect you to work when you're sick. And other departments said, well, if you want to work, then sure, work from home. But there was also a concern about any employees who might call in every single time it was their turn to work in person and call in sick on all of those days, and to really work with them and understand what was going on. Did we need to have a further conversation? We had a lot of employees who needed to come in on the weekend or in the evening just to see the space. There was that much fear. And so that's something I highly recommend, is having people just be able to see the space and be calmer after seeing it when we're in that reentry process. We had people whose daycare had closed permanently and who were seeking additional flexibility for childcare, which was really important. So that flexibility was key. Having those conversations. We had sent people home with computers and monitors and chairs and desktops. And so getting those people laptops was better. We issued mice and keyboards. So each person would have their own, even if they were sharing a space, they would have their own keyboard, their own headset for their phone, so they wouldn't have to touch those things. And then the understanding that people would wipe things down when they came in and wipe things down when they left. So again, people knew what the expectations were for all staff. So lots, and we also did, like Russell talked about, start putting on our job postings what percentage of the time for each job was remote and what was in person. And we communicated that to staff as well. We made sure we had telecommuting agreements, but we also talked about what percentage of this job could be done remotely. And we talked to the staff about that. We did that by job title, not for individual people. And so we really wanted their input on that. And we do have some remote workers. And to Russell's list, I will add that workers' comp policies were an issue for us to get workers' comp policies on people who are 100% out of state, in addition to following minimum wage and state laws, local laws. But getting those worker comp policies, we had to get individual policies for each of those people. So that was a burden and a hurdle for us as well. But there were lots of silver linings that came out of the pandemic and out of reentry. We increased our reliance on virtual meetings. Our Hispanic, Native American, African American, and Asian Heritage Months quadrupled in the number of offerings, and each offering doubled in participation. So we had Diversity Day 100% virtually. Our training academies went to virtual. We increased our participation in all of those different topics. So people wanted to connect through training, through conversations, through robust and difficult conversations. That helped them connect to people. We also were very aware of fear. We were partnered with our EAP, and we added mental health and self-care to our orientation. Because we saw those issues coming forth. We saw that people were resilient and they were coping, and then there would be one small thing that would be too much for them to deal with on that day, and to have someone have a conversation about that and say, are you okay? What's going on today? How can I help you? Really made a huge difference, because we were encountering so much change, and the new normal is still changing all the time.
Hey,
So,
Erica, I know we only have a few minutes left, so I wanted to ask a question. So you said that you moved out of your office. Did your lease end? And if it didn't, did you have someone to negotiate your getting out of that lease?
That's a great question. In HR's case, our lease was up and up for renewal, but in a couple of the other cases, it was not. And the facilities team, our facilities director, did help negotiate getting us out of the space that we needed to.
How much more time did you have on your lease?
How much, pardon?
How much more time did you have on your lease? How many more years did you have?
In HR, as I said, it was up for renewal, but the IT lease did have more time left on it. I know for certain. I don't know how much time.
Great. We have several years on our lease, so we're not in a position, but we are trying to see if there are some concessions in some way that we can, we do sublease with some of our affiliate organizations here. And we're hoping to see if we can not so much reduce our footprint, but see if they would give us some concessions. I do have a question. I think it may be for Russell. Russell, I'm just curious. So if anyone is trying to find a website or a resource, the best resource to get information in terms of legal issues returning back to work, can you recommend a website for the participants to view?
Well, sure. I'm first I have to give a plug to Morgan Lewis. We have a lot of great resources ourselves. So if you go to our resource, but also, as I mentioned before, the Department of Labor has some really good, you just type in COVID, the Department of Labor, the EEOC, OSHA, along their other government websites that you recommend?
The CDC's website for business is really good. And the CDC is often, or we anticipate will be incorporated as, a legal standard for what your duty of care is as well. So I think it's worth making sure you really do review all of these, not just because they're good resources, but because they could really ultimately set legal standards on some of these issues. But plug too, on both of our bios, we have publications and all of the safety and health ones. If you look through, if you want an easy way to find it, we've written a lot of articles on this.
Good. I can't see, I know there's some questions and I cannot see the questions. Callers, do you have any questions that we can ask in the few minutes that we still have?
Hey, we do, and we can go over just a little bit and 3 o'clock,
Just
but
a little bit.
there were some additional questions that were out there. One is that I know that Erica and Rose mentioned the telework agreements that they have. Do you guys have a template that is available that you can share with the audience? That was one question.
Sure, we're happy to share that. I can put my email in the chat and happy to answer questions or provide templates. We have a long version and a short version that we were using. The long version was more of a worksheet to talk through the telecommuting, but we found that for some people, they had already been doing it all along. So for new employees, the long version might be better suited.
Okay. And then
Yeah.
just for you guys, and I had one other question for Russell and Alana, but for Erica and Rose, you mentioned a 4-phase reentry program, and people wanted to know what were those 4 phases.
So I took a look at it, and Erica, you can certainly fill in. It really primarily addressed building capacity, how that was going to incrementally increase, and building access from, the public, like we said, completely locked buildings, appointment only, to the metered lobbies and so on. It addressed, how meetings would be conducted in terms of, continued remote meetings, or whether we could start having any kind of in-person meetings. And it also did address mask requirements, but that was kind of the one thing we didn't necessarily build in enough flexibility for. We realized once the CDC changed their guidelines, and I don't remember honestly now at this point which change it was, where we had to go back in and kind of rephrase it, because we wanted the ability to move along with the CDC guidelines. And so we did have to go back in there and touch that up. And so I think those are really the primary points that provided. And one thing I didn't mention that was addressed in there as well were like the board meetings, the county board, and while we are in phase 4, those meetings actually are still being done remotely. And one of the reasons is because, it's arguably even more accessible this way. Coconino County is a fairly rural county, and size-wise, it's the 2nd largest county in the country. And so, you'd have to, in some spaces, you'd have to drive 2 or 3 hours to get into Flagstaff, where our county offices are located. And so by having meetings accessible remotely, that actually provides greater access to those people without having that, burden of having to travel into Flagstaff. So I think that, Erica, again, you can add to it, but I think those are really the primary points that the reentry plan addressed.
You did a great job, Rose.
Yeah. Carlos, I think we probably, out of respect for people's time, want to go ahead and bring this to a close.
Okay.
I want to thank you all so much for joining us as we navigate these challenging times. We're all pretty much going through the same thing. We do hope you join us for our next webinar on the great turnover. I'm sure you're all probably experiencing the same thing with a lot of staff resigning. Many of us are experiencing or have experienced a turnover in these increased numbers. We're re-examining our recruitment process. I don't know about you, but we're trying to figure out what can we do to stop this bleeding. We're also enhancing our onboarding procedures. We're reviewing our benefits, and we're adjusting our job descriptions. And I'm sure some of you have pretty much done the same thing. Clearly, retention is becoming more and more challenging. How do we stop the bleeding? So we're asking you to join us in January to find out. So be on the lookout, as we will be sending information on dates and times. In the meantime, we will be working on developing a portal for professionals like you to have access to resources, including job descriptions, policies, trends, and other important information. Someone asked if you could share your telework policy. Once we get the portal up and running, these are the resources that you'll have access to. So rather than asking if anyone have any of these items, all you have to do is go into the portal, and hopefully many of those items will be there. So we're looking forward to extending and expanding this network. So again, thank you so much for joining us, and please stay tuned.